Minimally invasive shoulder replacement is a passion area for me. I've been doing a lot of shoulder replacements. I've done a lot of shoulder replacements over the last 12 years or so, thousands actually. And minimally invasive, taking it to the next level, if you will, is something that I think is a product of developments and advances in anesthesia, developments and advances in surgical technique, and in the design of the implants. So all three of those have sort of come together now. And when somebody says minimally invasive, that buzzword can mean a lot of things. And I can tell you what it means for me. For me, minimally invasive shoulder replacement is surgery that takes less time. So people wonder, well, how long does it take to do a shoulder replacement? And I say, well, I can, in my hands, a regular shoulder replacement, meaning when I say regular, not complex with another shoulder replacement that had been there before, or bone defects, or a fracture, or break, just a shoulder replacement, the garden variety shoulder replacement, which comprises most of my practice. That surgery takes about 30 minutes. The surgeons, my time in there is 30 minutes. The whole process is less than an hour. But the surgery, so when I communicate the length of time, what I'm communicating is trauma to the body, because all surgery, from a surgeon's perspective, is controlled trauma. So what I'm communicating to the patient is, listen, this is less controlled trauma. 30 minutes is not a long procedure. And a lot of people will say this, that ask me about what's the age limit of the surgery. I don't have one because it's a 30-minute operation. I don't lose a lot of blood. And you can go home the same day. Even older patients, I do about 70% of my shoulder replacements as an outpatient procedure. They come in, they have their procedure. It's a 30-minute operation. I get over the idea of a shoulder replacement or a joint replacement being an overnight deal. I've gotten over that 3.5 years ago, and I started doing outpatient. I'm still the only surgeon in Northeast Ohio who does outpatient shoulder replacement. I think that will change, but at least now it's true. And I got over the concept of a joint replacement being an inpatient stay because I started to ask questions like, how do my patients look after the procedure? Well, we use interscaling blocks, a nerve block, so you don't feel the surgery, which means I don't have to use much anesthetic, which means the patient's wide awake. After the surgery, the typical patient's wide awake. So if they're wide awake, they have a short procedure, and then I make small incisions. Typically, my incision is about that big for a shoulder replacement, and they can go home the same day. That's minimally invasive. To the patient standpoint, in my world, that's minimally invasive. And on top of that, the best part too is that they can use their arm pretty much out of the gate with most shoulder replacements. They can eat, drink, shower, shave, and dress, which we refer to as the activities of daily living. And I let them do that pretty much right after the surgery. I've probably done north of 3,500 of them. So I do about, I have the second highest volume in the United States. So I do the second most number of shoulder replacements in the US of any surgeons. So yes, I do a lot of them. I like doing them, so that's good.